There are many things that ruin a patient experience. In this week's tip, we're going over the 4 things that you can do right now to ensure that your patients stay at your practice. Stay tuned. All right, so in this week's tip, we're going to talk a little bit about the red flags of a practice from the patient point of view. And if we think about the patient experience, it starts with a phone call and it ends with, hopefully, recall, sometimes reactivation. But along the way, there can be things that the practice is doing that is actually creating an instance where the patient may not want to come back. So let's go over them. Number 1, your receptionist is rude. That's quite simple. It's not very hard. If you imagine you're a new patient, or if you're an existing patient and you're calling the practice and you want to make an appointment or you want to speak to somebody there and the receptionist is rude, well, you might not come back. And we see that quite a bit. So take a look at it. That usually happens when we are understaffed up front. I've been on hold with Blue Cross Blue Shield for 30 minutes. I've got a new patient on the other line. I've got a new patient walking in. I've got another patient walking up, and now the phone rings again. I might be a little bit short, and that may cost you a patient. So let's listen to some phone calls. Let's watch how the front desk handles all incoming communication and see if maybe we need somebody else. If that is the case, I'm going to put a link in the description below. You could request your very own new patient mystery call. We'll call your office, we'll record it, and we'll see how they do, and we'll play it for you. So tip number 2, waiting. If you make patients wait without their agreement to wait, they may decide that they don't want to wait anymore and they're going to go find an office that actually sees them on time. You tell patients to show up at 3 o'clock for their cleaning and you make them wait a half hour. But when they show up a half hour late, you reschedule them and charge them a broken appointment fee. So what are we telling the patient? Well, our time is valuable, but yours isn't. And patients, they don't really like that. And they may decide, and often do decide, to go somewhere else. So if you make them wait, and that could be in the office or it can be on the phone, you are going to lose patients. So let's take a look at those wait times. Let's see if that's happening. We can monitor some things for that, but waiting is a big no-no. So let's get to tip number 3, one of my favorites. You have a dirty office. All right, so how many of you have walked into a dirty restaurant and decided to leave because it looks gross and you don't want to put things in your mouth in a place that looks gross? Well, what do we do in dentistry? We have people put things in our mouths, and if it looks gross, I don't want to come back. That includes ceiling tiles turned the wrong way, paper everywhere, dust bunnies behind the printer, pen marks on walls, nicks, dings, scratches, all of these things patients look for. And once they find one of them, they will be on the hunt for everything else. So you really need to keep your office looking nice. You need to keep it looking fresh. You need to keep it looking clean. It's not very hard to do, guys. I would recommend that all of you do a walkthrough on your practice. Go walk the patient experience, video it, and see all of the things from a patient point of view. What chairs need to be replaced, what upholstery needs to be redone, what ceiling tiles need to be fixed. It's not very hard to have an office look like $1 million office. A little bit of paint, some furniture from Wayfair, and a few ceiling tiles goes a very long way. So have a clean office. Finally, tip number 4. There is no nice way to say this. I don't know how to say it any other way, but doctors, fix your teeth. I mean, come on, this is ridiculous. We're in the industry of dentistry. We're in making people healthy. It's very hard to believe in the dentistry that you're proposing when you yourself obviously don't believe in dentistry. I am not going to do ortho when you have crooked teeth. I'm not going to fix my own teeth when your breath smells horrible. I'm certainly not going to do it if you're not doing it, but it's also an indicator of your staff. So doctors, fix your staff's teeth. They are walking, talking billboards of how amazing your practice is. If you would like your patients to be able to talk to your staff about what fears they have and how you and your office can handle it, your staff have to know exactly what it's like to go through these procedures. So make sure that they have healthy mouths. They don't have to have the most cosmetically friendly teeth. I'm not saying that, but there are a lot of staff members that when we look at their teeth, it's clear they need some work. They're not brushing. They're not following protocols that you would do for yourself or your family or any of your patients. It is a surefire way to have patients leave the practice. Good. So I know that's a tough one, but it's really important. So these 4 things we went over contribute to the new patient experience, the overall patient experience, all of it, right? And we want to give the patient the best experience possible. There is a lot more to this. And if you want to learn how to get patients to want what they need, get them to come back, to refer their friends and family, like absolutely click that like button, sign up for alerts. You'll get more videos and tips and tricks on how to do all of this. If you're really serious about it, though, you should really look at one of our workshops. We have a new patient workshop that is designed to attract, acquire, and retain quality patients and get them in and get them coming back and referring their friends and family. There are a lot of things in that workshop that can turn into red flags if you don't do them correctly. So I'll put that link in the description below. Stay tuned for more tips if you like this one, and I look forward to seeing you in the future.